Hi, I'm Dr. Ashish Dutta. I am a cosmetic surgeon at the Aesthetic Beauty Center. Sclerotherapy is a treatment which is used to eliminate spider veins, telangiectasia, small thread veins, and of course some of the varicose veins of the lower leg. A medication, which is a sclerosing agent, is used to destroy the inner lining of the veins, and that's why it's called sclerosing agent. It scleroses the inner lining and helps the vein to die. Sometimes we need about 2 or 3 sessions, and of course gradually the vein slowly goes away. Spider veins or varicose veins are parts of the venous system of the lower leg, but they are on the surface, so they're easily seen or visible, and it makes people feel more conscious. It happens more often in ladies, and we know people who stand for long periods for their occupation or for their hobbies, and of course some of them are related to their genes. So genetically, if mom, dad or somebody in the family has varicose veins or thread veins, you are more likely to get it. There's another factor which is unavoidable for ladies, is pregnancy. Often pregnancy brings on these veins of the lower leg. Foam sclerotherapy is very similar to sclerotherapy. We use exactly the same medication that we would normally use for sclerotherapy, but we introduce a little amount of air, or in some cases sterile carbon dioxide gas, and we make them into a soapy foam solution. The advantage of that is, in bigger veins, as we inject the chemical, it usually flows away with the blood flow that is in the blood vessel itself. But the foam helps the chemical to stick onto the sides of the veins and helps the chemicals to act on the vein wall and helps them to die quicker. And so for varicose veins and some larger thread veins, we would use foam sclerotherapy. Most often, sclerotherapy works very well. You need anything between 2 to 4 sessions depending on how big the veins are, how numerous the veins are, and of course some of the veins are pretty stubborn and they're interconnected, and you may need more sessions. Overall, I get about 80 to 85% control of varicose veins or thread veins with sclerotherapy. Some of the varicose veins will need excision and operations for other reasons, but overall I think if I can promise my patients 80 to 85%, most patients are happy to accept that. Like any medical treatment, sclerotherapy also has some side effects. Some of them are relatively common, but most of the serious side effects are pretty rare. The common side effects are like bruising, swelling, a bit of local itchiness, redness are relatively very common, and the patients will usually cope with them. Very rarely we find that the area can get a bit of a slough or a scab, and if the area is not scratched or picked, usually they heal very well, and all these complications that we mentioned can be avoided or even prevented by using a class 1 or class 2 tights for between 5 to 10 days after the procedure. There are some rare side effects, like you can get a deep vein thrombosis from the treatment, or even matting, which is the area becomes even more full of thread veins, or telangiectasia we call it medically, like thread veins or spider veins. But these are not very common, and my patients usually get 80 to 85% clearance. And one thing we have to also remember, that telangiectasia, thread veins, varicose veins are ongoing. So in the future it doesn't prevent, so sclerotherapy will never prevent these new veins from forming in the lower leg or other areas of the body. Varicose veins can be treated with surgery or with sclerotherapy. and particularly foam sclerotherapy is pretty effective against varicose veins. But sometimes the varicose veins are pretty stubborn and they are interconnected, and for those we advise we need an ultrasound scan to rule out any other underlying pathology, and then the veins may need to be stripped, or even under local anesthesia we can remove the veins bit by bit. Sclerotherapy in general is a relatively pain-free treatment. It of course causes a little bit of a burning sensation when the chemical goes in, but the patients tolerate it very well. And when we expect 85% of the veins to sort of disappear within a 3 to 4 month period, patients are quite happy to accept it. And most of my patients come just before summer, but I always tell my patients that treat the veins as and when it comes, because then you can get it or eliminate the veins at the early stage, and it doesn't then proliferate into a larger area.